So today's topic is salivary glands tumor. The salivary glands tumors can be either benign epithelial tumors or malignant epithelial tumors. The example of benign epithelial tumors are pleomorphic adenoma, Warthin tumor, oncocytoma, whereas the malignant epithelial neoplasm are adenoid cystic carcinoma, mucoepidermoid carcinoma, acinic cell carcinoma, or adenocarcinomas. So first we are going to discuss is the benign epithelial neoplasms. The first comes the pleomorphic adenoma. The pleomorphic adenoma, it is also known as a mixed tumor. It is the most common benign neoplasm that consists of cells exhibiting the ability to differentiate to epithelial cells or mesenchymal cells. The pleomorphic adenoma is the most common tumor of the salivary glands. So which of following is the most common tumor of the salivary glands? It's the pleomorphic adenoma. The parotid gland is the most common site of pleomorphic adenoma. So the parotid gland is most commonly affected, mostly the lower pole. So in the parotid gland, this tumor most often presents in the lower pole of the superficial lobe of the gland, and around 90% and about 10% of the tumor that arise in the deeper portion of the gland. Almost 8% of the pleomorphic adenoma involves the minor salivary glands, and the palate is the most common site of the involvement. The pleomorphic adenoma, it occurs more frequently in the females than in males. The majority of the lesions are found in patient in 4 to 6 decades, and the average age of occurrence is about 43 years. So how the pleomorphic adenoma develops? The patient give a history that is a nodule which is a small, painless, which slowly begins to increase in size and somewhat intermittent growth. The pleomorphic adenoma, particularly of the parotid gland, is typically a lesion that does not show fixation to the deeper tissue or to the overlying skin. Pain is not a common symptom of the pleomorphic adenoma, but the local discomfort may be present. The palatal glands are frequent the site of a region of tumor of this type. What are the histological features of the pleomorphic adenoma? The pleomorphic adenoma, it begins as irregular to ovoid mass with well-defined borders. The tumors in the major gland either have an incomplete fibrous capsule or are unencapsulated. The minor glands, they are unencapsulated. On the microscopic, you will be able to see a combination of glandular epithelium and mesenchymal like tissue. That is, it consists of the cells are principally the myxoid type. So these are the myxoid tumor with myxoid. The right one shows the mixed tumor with the myxoid component, and the left segment shows fibrous or epithelial component. So the myxoid and cellular component are present, or it could be predominant cellular or extremely cellular. So the pleomorphic adenoma demonstrate combination of glandular epithelium and mesenchymal like tissue. The proportion of each component varies widely. So they are divided into principal myxoid and cellular component present in equal proportion, or predominant cellular or extremely cellular. The epithelial component form the ducts and small cyst. It contains eosinophilic coagulum, small cellular nerve sheet of cells. What are the major component? The major component in the pleomorphic adenoma are the myoepithelial cells. So they have a angular spindle appearance, eccentric nuclei and hyalinized eosinophilic cytoplasm. So they are responsible for mesenchymal like changes. The myoepithelial cells are responsible for the characteristic mesenchyme like changes. So these changes are brought up by extensive accumulation of mucoid material around the individual myoepithelial cells that gives a myxoid like appearance. Now what is the treatment of this pleomorphic adenoma? It consists of surgical excision. The intraoral lesion is treated conservatively by intracapsular excision. As it is radio resistant, so the radiotherapy is contraindicated. Next comes the Warthin tumor. The other name of Warthin tumor is papillary cyst edema lymphomatosum adenolymphoma. So which is the second most tumor of the salivary glands? The second most tumor of the salivary glands is the Warthin tumor. It is the tumor that arises in the salivary glands tissue entrapped within parathyroid or intraparathyroid lymph nodes during embryogenesis. Which tumor has a strong association with smoking? The answer is the Warthin tumor. The Epstein-Barr virus has also been implicated in the pathogenesis of this tumor. Warthin tumor, it is most common in the men. Recent reports have identified a substantial percentage of patients who are women. This tumor presents in the 6th and 7th decade and average age of patient at time of diagnosis of lesion was 62 years. The tumor is generally superficial. It lies just beneath the parotid capsule or protruding through it. It is not painful, is firm to palpitation, and is clinically indistinguishable from other benign lesion of the parotid gland. The macroscopic feature of this tumor are it is smooth, somewhat soft parotid mass and is well encapsulated when located in the parotid gland. Now what are the microscopic features? This tumor is made up of two histological components. One is the epithelial and other is lymphoid tissue. So the cyst formation is common with papillary projection into the cystic space and lymphoid matrix showing the germinal centers. The cysts, they are lined by papillary projection of bilayer oncocytic epithelium. The inner layers, they are tall columnar with finely granular and eosinophilic cytoplasm with the presence of mitochondria and hyperchromatic nucleus, whereas the outer layer, triangular, they are oncocytic triangular and occasionally fusiform basiloid cells. So on high magnification microscope, you will see this kind of structure. The electron microscope will show oncocytes in the tumor cells. So these are the oncocytes and they have abundant mitochondria and nucleus. What investigation would you perform for this Warthin tumor? You can perform cellography or scintigraphy. What is the treatment? The accepted treatment is the surgical excision. Malignant transformation is rare in either the epithelial or the lymphoid component. Next is the oncocytoma. It is also known as oncocytic adenoma, oxyphilic adenoma or acidophilic adenoma, which is the rare benign tumor composed of oncocytes with granular eosinophilic cytoplasm and large number of atypical mitochondria. The answer is oncocytoma. This rare salivary gland tumor is a small benign lesion which usually occur in the parotid gland. The name oncocytoma is derived from the resemblance of this tumor to the apparently normal cells that has been termed as oncocytes. And these cells, they are found at greater number of locations including salivary glands, respiratory tract, breast, thyroid, pancreas and parathyroid and stomach. So these cells are predominant seen in the duct lining of glands in the elderly person. Now what are the clinical features of oncocytoma? It is more common in women than in men and occur exclusively in the elderly person, seen in 5th to 8th decade of life. The tumor generally measures 3 to 5 cm in diameter and has a encapsulated mass that is sometimes nodular but often multilobular. So what you see here is you will see the nodules of oncocytes which involves the entire gland or large portion of it. Now what are the histological features of oncocytoma? It is characterized by large cells. The large cells that have a eosinophilic granular cytoplasm and a distinct cell membrane that are arranged in a narrow row or codes. So these oncocytes, these are arranged in sheets or nest or codes. So there could be seen some atypia, nuclear hyperchromatism or pleomorphism. Few mitotic figures may also be seen. Lymphoid tissue is frequently present but does not appear to be the integral part of the lesion. So you can see this picture showing the oncocytoma composed of uniform cells with the pink color is the cytoplasm and centrally placed nuclei. On electron microscope you can see the oncocytoma, they are filled with mitochondria nuclei in the lower left and right side. Now what is the treatment of oncocytoma? The treatment is excision. Now what are the malignant tumors